My name is Joshua Blatter, and I'm a pediatric pulmonologist. My specialty is lung transplant in children, and I work at Washington University in St. Louis, Missouri. I'm also a transplant advocate, and that's what I'm here to talk with you about today. But I'm actually going to start by telling you a story. The Logan Effect was a documentary that was produced by Sports Illustrated in 2019, and it refers to a bus accident that happened in Canada and the aftermath. The Logan Effect specifically refers to Logan Boulais. He was a young defenseman on the Humboldt Broncos in the Saskatchewan Junior Hockey League. When he was 19, he developed a close relationship with a coach that he called Sluggo, and his skills really blossomed. But a couple of years later, unfortunately, Sluggo died of a cerebral hemorrhage at the age of 58. Sluggo had a conversation with his wife several weeks prior. He wasn't identified as an organ donor. He noticed that wasn't on his license, and he wanted it to be. So Sluggo's organs were actually donated, and he was reported to have impacted 6 lives. Around his 21st birthday, Logan Boulais was thinking about Sluggo still, and he told his dad that he really wanted to be an organ donor someday too. On April 6th, 2018, a bus carrying the Humboldt Broncos team crashed, and of the 29 passengers on that bus, 16 of them died. Logan Boulais was gravely injured, and he actually died 1 day later. Given the intensity of the accident, his organs were remarkably well preserved, and his heart, his lungs, his liver, and other organs were donated. And Logan's story became an international news story. In subsequent weeks, tens of thousands of people across Canada signed up as organ donors, and it's been estimated that perhaps more than 200,000 people ultimately have signed up as organ donors inspired by Logan's story. Thousands of people now currently in Canada commemorate Logan's death and his gift on Green Shirt Day, which is a day that's organized around transplant advocacy. So what does it mean to be a transplant advocate? What happened in this story? His coach gave his organs, which inspired Logan to make a gift. And Logan, in turn, inspired people really across the world. But things started small, and ultimately thousands of lives perhaps were saved. So advocacy can involve helping one person, say for instance, a family member who's had a transplant, can involve helping several people or a group of people, say for instance at your local transplant center. And transplant advocacy can also involve helping people in the world around, both in the present and potentially in the future as well, when it comes to doing things like helping out with research or policy. So let's talk about each of those in turn, and let's start by thinking a little bit about ways in which we can sort of start small with advocacy. Families of transplant recipients advocate for family members all the time. So let's say you're the family member of a transplant candidate or recipient. If you do nothing but help take great care of your family member, you are being an advocate. And for many families, that is absolutely enough. But many patients and families do ask if there is something else that they can potentially do. And that's some of the stuff that I want to be able to talk with you about today. If you're involved in the world of transplant, you are probably already an organ donor. But talk to other family members about becoming donors as well. Not all donation, of course, occurs merely from people who have died, so you can keep in mind that you can be a living donor of a kidney or a bone marrow transplant donor, for example. If you have questions about being a donor, perhaps start with your local hospital and move outward from there. Let's talk a little bit about local action and how you can potentially impact several other people or a group of other people. When you contact your transplant team, say, how can I help? That should trigger them to put you in touch with the right people. Many hospitals have a foundation arm that handles charitable donations of all kinds. That can be money. It does not have to be money. And let me be clear, helping can mean almost anything. It can be providing some food for other family members, blankets for family members, spending time with other families. Helping, yes, can mean money, but it does not have to, and don't let the fact that you don't have money to give stop you from saying those words, how can I help? Money is only one way for you to actually help out at all these levels. So let's talk a little bit about national action as we sort of move outward and think a little bit about advocacy and how we can do that in an even broader sense as well. Start by reading health news. When you hear things about healthcare funding in the United States, those issues have a huge impact on transplant patients, their ability to pay for surgeries or the ability to take their medications afterwards. And you can get transplant-specific news from the American Society of Transplantation website or the patient-focused website at powertosave.org. So I want you to think about those as opportunities to learn more about transplant and learn where you can make a difference. The United Network for Organ Sharing, or EUNOS, is a nonprofit organization that manages our nation's whole organ transplant system. And you can get lots of news at their main website as well. And they also likewise have a patient-focused portal at transplantliving.org. EUNOS is always enlisting official EUNOS ambassadors to spread the word about transplant in the community or in the wider world, even on social media. So if you have questions about that, visit the EUNOS website and find out more about becoming a EUNOS ambassador. Other national actions to stay involved in transplant, though, can also involve research and policy. So let's talk a little bit about each of those in turn. So what's research, and why do we do it? Transplant outcomes could be better. We could be better at surgeries. We could have better drugs that we use for immunosuppression. We could do a better job of treating infection or rejection. We could have better treatments. But the way that we make transplant better is through research. And it is true that research really is driven by money. So you can give money to an organization like the AST, for example. The AST has raised over $10 million in the last decade for research organized around transplant. And if you have questions, maybe you don't have a bunch of money to give, but you have questions about fundraising, there's lots of great information about fundraising on the Power to Save website. Remember also that a lot of research is government funded. So when you hear things about government funding of research, among the things that we're actually funding is transplant research, and it may be important for you or your family. Finally, let's talk a little bit about policy and the fact that, among other things, policy is really about changing minds around transplant. So again, when we talk about healthcare in the United States, we are talking about transplant too. If you hear things about transplant funding, that potentially impacts you or a family member who's had transplant. The Power to Save website, again, is a great source of news, information about current government debates. And the Power to Save website also makes it easy for you to write your congresspeople as well, which is another way, potentially, to impact policy. So when you think about changing minds, a lot of times people just think about policy and contacting people individually or writing letters. We can keep in mind, use your social media accounts for that too. If you do have social media accounts, make sure that you follow the AST on social media. Make sure that you repost and forward transplant news. And make sure that the people who follow you know that you are a transplant advocate. So in conclusion, let's talk about Logan again. Logan and his coach imagined that maybe someday they might impact a few other people. Their small but significant gift ignited a worldwide movement and changed thousands of lives. And it's a reminder that no matter how small you might start, you can potentially have an enormous impact. So again, if you do nothing but take care of yourself or a family member, that definitely can be a form of advocacy. But if you're wondering how you can potentially do more, I hope that we've laid out some ideas for you today of ways in which you can impact other people at your local center or other people potentially across the nation or across the world. Thank you very much.